In these videos, I often say patient or client when I refer to the people who see psychotherapists. It's a little awkward, but I do it for a reason, and in this video, I'll tell you why. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator. If you like what I'm doing here, subscribe to this channel, More Than Meds. It'll make us both feel good. I'm a psychiatrist. Psychiatry is a specialty of medicine, and as a medical doctor, I treat patients. It's just the way I was trained. But the great majority of mental health professionals are not medically trained. They're not medical doctors. They're psychologists, clinical social workers, marital and family therapists, licensed professional counselors, and others. And most of these folks refer to the people they see as clients. There's no real rule about this. Sometimes it depends on the context. In medical settings, say in a hospital, the word patient is used by everyone. Psychiatrists and psychiatric nurse practitioners, of course, but also the psychologists and social workers use the term patient because that's what's used in that setting. Outside of medical settings, non-medical therapists more often use the term client. Many people hear a power differential in the word patient. Patients have to literally be patient and wait for the doctor in a waiting room. Doctors are always busy and running behind schedule, and they always have more patience than they have time. It also implies sickness. A patient has an illness and they seek treatment for it. Maybe they can be cured of their disease or disorder, maybe not. Medical anthropologists note that being a patient involves being in a sick role, a recognized role in our culture. It includes not being able to perform your usual daily tasks, living your normal life. Usually it means that you're hurt or suffering in some way, and that you require the services of other people, that you need to be cared for, that you're temporarily vulnerable and dependent. It's everything that goes into what it means to be ill or sick. Now, if you're healthy, using the word patient in a psychotherapy setting sounds like you're voluntarily choosing to disempower yourself and make yourself dependent. Why on earth would you do that? But if you're weak and suffering, there's great value in being in the sick role. You can legitimately make claims on others for help or assistance, help that they wouldn't provide if you weren't sick. You can call in sick to work. You can have someone fill in for you, and they wouldn't normally do that if you weren't sick. Most important, you can put your health and sometimes your very life into the hands of another person or another group of people who will take responsibility for you, at least for the moment. Now, in contrast, the word client means something very different. A client is not inherently impaired or dependent or vulnerable, and they're not disempowered. A client is simply a person who hires a professional to perform a certain task. Clients hire lawyers, they hire accountants, they hire massage therapists and wedding planners. Being a client is a step up from being a customer. Customer means a user of non-professional services. If you go to a grocery store, you're a customer. If you hire a catering service, you're a client. So mental health professionals who use the word patient are using a term that implies caring for an impaired person, whereas those who use the word client are using a word that implies providing a professional service for someone who isn't particularly dependent, vulnerable, or impaired. And where there's no implied power differential, or if there is one, it's the client who has the upper hand since they're the ones doing the hiring. Both of these words have their place. Both of them capture some of the reality of seeing a psychotherapist. Some folks who seek therapy are an emotional mess. They're not functioning very well at all. They genuinely need caretaking, and the word patient may fit better. Others function quite well overall and may be seeking psychotherapy for problems that are really invisible to the casual observer. And in that case, the term client may fit better. Historically, psychiatrists like me tend to treat more severe cases, so the term patient usually fits better in our practices. This is true both because we're medically trained and also because our patients are more apt to fulfill that sick role that I described. But let's add another layer of complexity here. How a person feels they function, how they see themselves as functioning, can be totally different from the way they actually function. Some people embrace the sick role much more readily than other people. To take the two extremes, there are people who, for personality reasons, chronically inhabit a role of being sick, dependent, and in need of other people's help. These are patients in search of a doctor or a healer. Whereas others, also for personality reasons, deny any need for help and would actually take offense at the dependency implications of the term patient. They see themselves as clients if they decide to hire a therapist at all. So even though it sounds awkward, I try to use both terms, patient and client, when I'm doing these videos or in my writing. I want to be all-inclusive and cover users of mental health services, whether they're very impaired or less impaired, and no matter how they see themselves. Note, by the way, that I'm very careful not to refer to mental health professionals as providers or the people we see as consumers. These terms were introduced not by clinicians, but by corporations and by government to commodify what we do, to turn it into a commodity. I talk about turning medical practice and mental health care into a commodity in this video right here. In short, these terms take the human element out of a very human healing relationship. They make different mental health professionals sound like interchangeable providers, as though we furnish a kind of commodity good where the supplier doesn't matter, like bushels of wheat or corn. And it likewise reduces the dignity of the patient or client to that of a consumer, someone who's merely taking or consuming something, like buying it off the rack or off a store shelf. Whether you see yourself as a patient or a client, or whether your psychotherapist refers to you as a patient or a client, is meaningful and important. But ultimately, this choice is secondary to seeing you as a person. A unique individual entering into a relationship with someone you trust, someone who's trained to help you. Thanks for tuning in today. Stick around, I have more for you to watch. Please like this video, but only if you really like it, and please subscribe to my channel. I look forward to your comments below, and I'll see you next time.